Welcome, everybody, to this session of HealthIMPACT, Telehealth and HealthTech, helping providers practice at the top of their license. Our vision at eVisit is to simplify healthcare delivery to everyone, everywhere. This today mostly means that we facilitate locally relevant but remote visits and hybrid workflows, which at its core means reducing logistical barriers to care delivery. In practical terms, this also means improving clinical efficiency so that doctors can spend their time doing what they went to school for, what they love to do, what we all need them to be doing, treating patients. eVisit is a telehealth SaaS provider offering the industry-leading virtual care platform. We often say eVisit is a telehealth company in the same way that Amazon used to be a bookseller. We're continually increasing the scope of our tools and our partnerships to provide more and more comprehensive solutions to the market's ever-evolving challenges. More and better ways to further reduce those logistical barriers to care and to improve clinical efficiency. Technology advancements are happening every day, and those that embrace these approaches to work smarter help drive the change needed in healthcare. Embraced properly, these solutions can mitigate burnout. Coordinators and admin team members, technology is becoming a crucial aspect in advancing patient care delivery. Here's some stunning stats. Between 40% and 66% of a doctor's time is spent on administration. That means in some cases that for every hour that a doctor spends with a patient, he spends 2 hours on administration. The NIH says that the highly trained US physician has become a data entry clerk required to document not only diagnoses, physician orders, and patient visit notes, but also an increasing amount of low-value administrative data. More than half of US physicians are now experiencing professional burnout. Burnout is reaching crisis proportions in the United States. This constitutes what we call at eVisit the efficiency gap, and technology can help. I'd like to introduce Dr. Siavash Panah, Banner Health Technology Ambulatory lead physician and an expert at using telehealth to serve patients in the pulmonary and sleep medicine specialty. Together, we'll address the topic of technology and how the use of telehealth and health tech is improving providers' practice, helping providers to practice at the top of their license. Dr. Panah, thank you so much for joining us to share more about telehealth and health tech. Let's start by addressing your specialty, pulmonary and sleep medicine. Tell us a bit, if you would, about your field of medicine and the patients that you help.
Sure. Thanks, Miles. Thanks for having me. I was listening to some of these facts you're saying. That's very interesting, and I know the world that you live in is very interesting, and maybe in a different life, life would have taken me that way. I would have been there with you over there. But so, and that's kind of where I find myself having been pulled into the force of telehealth because I always did have this interest. My subspecialty is pulmonary critical care and sleep. I run the gamut basically as a critical care doc. It's inpatient, it's a primary service. We admit our own patients, we take care of critically ill patients in an inpatient setting. As an inpatient consultant, as a pulmonologist, I'll provide care for other physicians, patients, and a consultative service. And then we can transition those patients to the outpatient setting in clinic, where I would see either pulmonary patients or sleep patients. In its current formation, my practice is very heavy with sleep patients in the clinic setting. So that's sort of the gamut, and sleep is not just about sleep apnea, although that's the one that garners the most attention, but there's a variety of issues in sleep, from not sleeping to doing unwanted behavior during sleep, and to, of course, sleep apnea, which is very important.
Absolutely. Well, thanks so much. Can you talk to us a little bit about what the highest value applications of telehealth are in your specialty?
Yeah. So for us, the thing that comes to mind, again, keeping in mind that the duality of what I do with inpatient ICU and then outpatient sleep, probably early in the game, I don't want to cite false data, but I would say easily 10 plus years now, there was an early identification that a critical care trained physician overlooking the care of critically ill patients provides better outcomes for all involved. From the real value, which is the medical care of the patient to the dollars and cents of administrative work. Um, Critical care docs were a high commodity at the time, and not
Yeah.
too many of us around for the number of hospitals that are there, in particular in rural settings. So an idea was developed of these EICUs, if you will. I'm not using a brand name, just referring to them as sort of a telehealth ICU care. This is where an ICU doc could sit at a command station overseeing a variety of hospitals, providing critical care, real-time critical care evaluation and consultation to critically ill patients at facilities where a critical care doc isn't available. So that's definitely probably top of mind for me when it comes to using the idea of telehealth in one of my own subspecialties.
Mhm.
And another area where I overlap closely with is telestroke. So that's where, again, same idea, driven by data and experience over time. Early identification, appropriate screening by the right team results in better outcomes. The adage of time is money, and time is brain, born out of that old saying of time is money. The earlier we get to these patients, the more brain we can save. And again, neurologists are also a high commodity and a rare commodity, and to be able to have quick access, evaluation by a neurologist brought to the bedside, no matter where the patient is. That was another great use of telehealth. And we have certainly benefited from that at multiple hospitals I've been at. And Banner has been very strong in developing that program across their hospital systems. And last but not least, when I actually joined this particular group here, one of my tasks was by my senior partner was to try and extend our reach into the rural markets that are around us, who are currently not able to reach a specialist as easily. This is pre-pandemic. We began to have a tele-clinic for sleep. And we began using teleservices to conduct sleep medicine consultation across state lines, for example, locations that were 6 to 8 hours away from us. And so we were already getting the ball rolling. And then the pandemic hit, of course, and we got a shove in the back into really using that technology. And when our clinics had to close due to uncertainty of behavior of the virus early in the process, we had this very quick conversion to using telehealth to conduct our clinic visits. So we did wind up doing pulmonary and sleep and everything else everybody was doing. We have grown from that together. Your company has and ours has. We have now gotten a lot better at doing things, I like to think.
That's right.
Some painful mistakes and growing pains. But I think overall, the experience that I have now personally is very positive and enjoyable. The experience I hear from my colleagues has shifted. Even those who at first were not very agreeable to the idea of doing televisits are now actually learning to incorporate that into their practice. And patients, more importantly, I suppose, are actually enjoying it and really enjoying the flexibility of having televisits.
Yeah. It has, of course, we all lament deeply the tragedy that has been the COVID pandemic, and we've all lost friends and family to the disease. But certainly the silver lining, if there can be said to be one, I would say has been the rapid adoption of telehealth that has allowed the proliferation of technologies to combat some of the conditions that you've spoken to. So it's been an honor to work alongside Banner. There have certainly been some challenging points. At the height of the pandemic, we onboarded some 7,000 Banner providers within 10 days, and,
I remember seeing those staggering numbers. Yes.
Yeah, the Banner visit counts have just taken off from there, offering such a wide array of services. It's been a phenomenal effort at Banner, you and your staff and everyone else over there.
I think if you wanted to make 7,000 badges in 10 days, that would be a challenge, much less try to onboard people into a telehealth platform. So you guys
That's
did great.
right. But a few minutes ago, I cited the stats surrounding physician burnout, and
Mhm.
technology is usually cited as a mitigating factor for burnout. But sometimes, if it's improperly adopted, it can actually, unfortunately, contribute to burnout. Has this been, to what extent has this been your experience? Can you provide us any examples of where that's been the case and how you've worked around
Mhm.
it?
Yeah, no, it stuck out when you were giving those proportions of time spent, and you know, I've wrestled with that. I have to admit, at times, definitely been frustrated myself, felt frustrated. And when changes were imposed, this is years back on the transition to things, or anytime I've joined a new practice, I have to learn their new system. And so I'm not going to say that my view has always been glowing and positive. However, if I take an honest introspective look, I do believe that this has been a positive change. I say this meaning the shift to using technology in our day-to-day medical care in the form of EMR, in the form of electronic medical orders, electronic drug order entries. Keep in mind, while I may look extremely youthful,
Yes, you
I
do.
did train at a time. I was fishing. I did train at a time when it was 100% paper charting. As a matter of fact, as a medical student, one of your most glorious jobs was to write down patient names, go downstairs to the lab, flip a logbook of labs
Huh.
to find the name, the medical record number, cross match the name, then see if any cultures had grown positive, identify those, and then run back to rounds and wait for your moment to shine when they ask any new cultures. So just the fact that I think we take it for granted that I can just click a few buttons and get a span of the last 10 cultures that have been done for a patient and which ones were positive and what the sensitivities are for these bugs. I think those kinds of things get lost. The benefit, the value of those things get lost when we are frustrated from a natural day. Medicine's emotional. I think most good physicians will, if not able to sympathize, they definitely have empathy, and empathy comes with a cost. It does drain you, and we're humans too at the end of the day, and so we may be just drained. The tank may be empty, and then on top of it, you get error messages popping up on your screen. It's
Yeah.
easy to get frustrated, but when we pause, I think, and take a good hard honest look at things, I think there has been a tremendous positive change, even just in the short amount of time I've been in medicine. I've gone from the time I was a med student to being completely paper, and to the time I finished my last fellowship being fully electronic. And that's a very short amount of time, maybe 10, 12 years total.
Yeah.
And we are in any growth, that's any change that's worth making is going to require effort, and it will be probably painful. But ultimately, once the change is settled on a good foundation, you'll grow into something better than where you left. And I think this is one of those that was worth making the change. So can it contribute to burnout? Yes. Is it intended to do so? Obviously not. And when products are being made, when software is being developed, I think everybody has really good intention. But I think over time, we have learned that the more relevant players you have at the table early in the design process, the more likely the end result will feel organic when it comes out into production. And I think that's where things are headed. The newer products, the newer things that are coming out, I feel are becoming less and less burdensome, for lack of a better word, and easier to adopt.
Yeah. We have a saying at eVisit that the best user interface is no user interface. And one of the things that we're looking to roll out next year that we've been working on is being able to record remote encounters and then transcribe that using a combination of artificial intelligence and an actual flesh and blood scribe and coder, so that just a few minutes after you finish your encounter, you get a finished note
Wow.
that's fully coded. We're understanding that documenting, that having to take the time after a visit or having to take the patient's time to document during a visit is one of the things that is frustrating to physicians, and that's a problem we would love to be part of the solution for.
Wow, that definitely you would be on a lot of people's Christmas list, I think, if you could produce something like that. It is. I believe that documentation is important. I believe that it's good for us to communicate in the chart appropriately with the appropriate degree of communication. But I think sometimes we felt frustrated by having to use specific language or what seems like less relevant information, but had to be included because of certain rules and regulations. And I'm happy to say there are some changes that were being made actually this year to the coding and billing rules that allowed us to be a little bit more liberated and document more organically for outpatient visits, at least for now. And I think that combined with being able to capture the visit naturally, whether by AI or a kind of a live scribe, if you will, format, would go a long way to satisfy not just the physician that just completed the visit, but also the entire workflow, because the faster the notes are in, the easier the communication to the next provider that has to touch this patient, the faster orders go in that are dependent on those notes to proceed and be placed. So I think it will move care forward altogether. That would certainly be high on my list of wish on my wish list.
Well, thanks for the feedback. We've talked about the telehealth platform a little bit, of course, and you mentioned the EMR. Are there any other technology tools that you find yourself using on a daily basis?
Yeah, I mean, an obvious one staring me in the face is right now the interface that we're using, right? So I think one thing, we used to have this communication over electronic platforms before. However, one of the things COVID highlighted was the need to be able to reach each other when we can't be in the same room. So whether learning to rely more on IM instant messaging communication, or more relevantly, meetings. And I think oftentimes at the beginning, I think I caught myself not knowing how to behave in a virtual meeting. You know, what do I do with my hands? What do I do?
Yeah,
You
you
know,
weren't
with
alone
my
there.
eyes? Yeah, where do I look away? Make sure I don't pick at anything, and you know. But the more we've done this, the more natural it has become, and I've actually come to really appreciate, again, one of those things where, in hindsight, I can see now that I'm able to have, for example, just a personal case. I'm in my growing role now with telehealth in Banner. I'm needing to meet multiple folks across a very wide region spanning 3-4 states. It would have been impossible for me to get face-to-face time in a short amount of time, because it would require me taking travel time, getting that approved, closing clinic, traveling, making sure they're available. This way, I can just say, hey, I'm one of the new medical directors for telehealth, and I'd like to have some face-to-face so I can tell you what my visions are and hear what your thoughts are. Can we get on? And we get on and we have a wonderful conversation for an hour, see each other. You see the nuances of facial movements while you're talking and sharing your ideas. And I think that's important. I think that human connection is important. Seeing somebody's face facial reactions to an idea that you're excited about is actually a very meaningful and powerful thing. So yeah, I think that
Absolutely.
would be, one of the pieces of technology that we're using more now.
Yeah. What is that stat? I forget the exact percentage, but it's something on the order of 70% of communication is nonverbal.
Yeah, absolutely,
Yeah.
100%. And I'm a strong believer in that. And so big fan of being able to do this, not implying that I don't want to be back in rooms and have meetings again, but much like to tangent it back into telehealth in general, sometimes folks who are not as pro as I am for telehealth will say, "What do you want to replace all of medicine with telehealth?" No, not at all. I don't. I don't even think that's possible, or it should be the case. What I think should happen is we have a wonderful tool, and we should learn to optimize this tool, and it becomes a one way to communicate with your patient, one particular way to interact with your patient. And so that's how I feel about video meetings as well, as it'll be a way for us to communicate. If you're in the same city, you're in the same hospital, you can communicate, great, get together in a room when the rules allow again. But in the absence of that, I think video meetings are great. So that's one. And of course, it's become second nature now, but email, being able to, simple things, right? We talk about technology, just the fact that now emails, the thread of an email, right? So your box
Yeah.
doesn't blow up into 50 messages in 1 hour, but it's just kept in a thread. That kind of subtle nuance that has crept into our life. I think if we pause and look back, we really have to appreciate those small changes that are so meaningful, I
Absolutely.
think, in our day-to-day lives that have made our lives easier.
Yeah.
Other technology, we just now exploring, for example, things like pulse oximetry, right? And again, just citing the top of mind example. They have changed so much over time. Now they're coming in the format of a ring that you just kind of put on your finger.
Yeah.
Much easier. There's no cables and box to leave at bedside, and patients can have an app on it, and they can put it on, and they'll send the data to you automatically, and you can see that. We are doing home studies now, home sleep studies, without all the wires, and they're becoming better and better. So we touch so much technology throughout the day that I think if I don't stop talking, you're going to regret asking your questions soon.
No, not at all. It's a great answer. I love what you said about telehealth being one tool in your toolbox. At eVisit, we're talking a lot these days about hybrid care.
Mhm.
And building out tools to really seamlessly bring together the care of patients in clinic and remotely, with the idea that patients are whole beings, and that what we're all really trying to do is to care for people holistically, cradle to grave, trying not to view any episode discretely, but rather as part of the patient's whole healthcare experience. And that's going to move in and out of remote and in-person care. And with Gartner telling us that by 2023, 30% of all patient provider encounters will be remote, that becomes even more important, so that those in-clinic encounters are seamlessly integrated with the remote encounters. You have all of the data available to you, regardless of the modality of care. So it'll be an exciting couple of years.
I was going to say, that's not too long from now at all.
No, it's not. So
Yeah.
with that in mind, what can you tell us about where telehealth, at least as it's implemented today, where does it fall short?
I think if I had a really good answer for that, I'd probably be sitting somewhere on a board for your company. So you'll have to accept a humble answer from me on the spot. I think technology, if you forgive me, I'm going to pick on eVisit for a brief moment. I'm a
No,
big
please,
fan of
please
you
do.
guys, but
Uh-huh.
when the first version, when we started, required patient account registration, dual scheduling, the blocks didn't match ours. I think we were trying to force two things together that weren't necessarily matching. And it's because we didn't have time, right? Like you said, 7,000 people in 10 days, and we did the best we could trying to get there. But we learned quickly from each other and together, and you guys adapted very, very fast. And we quickly came up with a second iteration of it. We were still challenged by patients' inability to easily get on. And then you guys had a brilliant idea of eVisit Express. And so that's where credit comes back to you again. And in a very short amount of time, you deployed a tool that even folks with dementia and limited use of all of their faculties could get on. And we expanded that to the rest of the system. Your latest iteration has been incredibly useful. And so, I think you talk about challenges. I would say the least amount of work that we put on the patient to join a call, I think is probably the best goal to achieve. And anything that stands in the way of that so far in other platforms, I think is a problem. And then from our end of things, previously, and again, this has been corrected over time, being able to have multiple folks on the call together, including translation services, for example, right? So that was huge, to be able to have more than just the patient and the physician, but have either a family member in a different state or a family member who had to be at work or communicating with their loved one, join a call. I think that was huge. And then adding translation services, the capacity for that was huge. I think those kinds of things were previously falling short. We're getting pretty close to a really great tool, and I'm sure you guys are going to keep coming up with really creative ways to do things. For our rural patients, those who don't have as strong a network.
Yeah.
I think that's a challenge right now. I find a little bit of challenge there. Although good news or bad news, everyone's so attached and addicted to cell phones that cell towers are popping up everywhere. So if not your Wi-Fi, at least over cellular, you'll be able to proceed with things. So I don't know if we can or will make tweaks so that if it detects that you're in a lower capability area, perhaps it degrades the quality, but at least allows for continuous audio to go through, but the video degrades, or some version of those kinds of things. Again, this is my humble answer on the spot.
Yeah.
I'll
That's a great answer.
And maybe I'll email you afterward then.
Absolutely. Yeah, we dealing with fortunately in this country where we are in a fantastic situation where 98% of people in the country have access to broadband internet, but that 2% of people is oftentimes the most needy when it comes to healthcare. And so that presents a real challenge, as you say. We've got some tricks up our sleeve there for going beyond the industry standard and being able to really crush the bandwidth availability. We'll see what happens first, whether we're able to release that technology or that 2% gets serviced through, like you say, the proliferation of cell towers or the new satellite internet technologies that are coming online. We'll see. And you mentioned the eVisit Express and its quick entry modality. That was certainly an epiphany for us and plays right into the notion that the best user interface is no user interface. So that we have learned a lot from that and are rolling out a lot of new applications with the quick entry modality for patients to make it just easy as can be for patients to get in. And then being able, in many cases, to leverage really deep integrations with the EHR for data sharing. maybe in our last few minutes here, we can get a little bit more personal. Outside of your career life as a physician, how else do you utilize technology to simplify your life? Do you have any examples you can share with us there?
Yeah, I think the boxes that keep stacking outside of our house, and my wife Carlos
That's
will
right.
attest to how many of those pieces of technology I try to use on a daily basis. But yeah, I'm a fan, and that's, at the onset of our talk, that's what I was alluding to. I love technology. I don't know, it's interesting. My best friend and my brother and everyone, they call me a Luddite because I'm not on social media. I don't participate in anything. So I have the friends I have, and if I need you, I call you. I'm that guy. And
Yeah,
but
best way to go.
but it's ironic for that guy to be helping lead telehealth in a system, and buying all the tech gear he can get his hand on. I do love technology. I think I'm always interested in something new that's coming out, not necessarily the grand, just a new thought. But we're gonna get slightly off topic here, but the Raspberry Pi, it's the simplest. I'm sure you and your audience probably are very familiar with that.
Yeah.
It's a simplest, smallest format of a computer you can basically have, and open source. And somebody bought a cheap water probe, moisture probe, stuck it in their plant, made a Twitter account for their plant, and hooked it up to a Raspberry Pi, where when the water goes down, the plant would tweet out a message saying, "Water me, please." It's just simple. When I read that, I was like, "Ooh, I gotta buy a Raspberry Pi." I can't even keep a plant alive. It wasn't for the plant, but it was just the idea of finding interesting ways to use technology that's there, right? So
Mhm.
of course, the catchphrase of Internet of Things, right? Like everything is now connected. We
Yeah.
bought a washer and dryer. It now messages you when it's ready for you.
Yeah.
So yeah, I use that. We use that. We're new homeowners as of 2 years ago, and I did not know how to take care of a lawn. I'd never had to take care of a lawn
Uh,
before. So it's a worthy adversary. It's a living beast, and it's difficult to keep it green, and my wife wanted it green, and I'm trying to be a good husband. And so our sprinkler system, I bought one that was Wi-Fi enabled and very customizable. And so sometimes during the day, I was like, "Ooh, I wonder if I maybe should do a little bit more here and a little bit more here." And we've got the cameras in the house, and you asked for personal, so I'm giving a personal example.
yeah, that's great.
I can look with the camera and see, okay, is the sprinkler hitting this now? And then flip back to the sprinkler app and change it. So I love that. I love that we can do those kinds of things. And I yeah, and maybe now you don't need to know all of the details, but I have gotten into listening to some old records, and there's a record player, but we have a Wi-Fi sound system in the house.
Uh-huh.
But I found that I can, through a connection, connect the record player to the Wi-Fi system. So now here I am playing a very, very old record on a record player, but I'm playing it off of my phone in the whole house. So that juxtaposition of things like that, I think that's what interests me.
Yeah, we've got a
I-
similar setup at my house.
oh, there
I,
you go.
and I love telling Alexa to turn on the backyard lights.
Yeah, absolutely. We, stuff like that. Like we wanted some dim lighting, and these days you just look everything up, and found a dimmable thing. So now I can tell the Alexa, dim the lights to 35%. So stuff
Mhm.
like that. I think is right. I mean, I wear one of these watches that tracks your steps and heart rate, and attempts to track your sleep, which of course I
Yeah.
geek over. And so things like that.
Well, fantastic. Thank you so much, Dr. Panah.
Yeah.
This has been a lot of fun. And for everyone attending, eVisit's virtual booth is chock full of useful guides and white papers, including the Forrester Wave report on virtual care, where eVisit is the solo leader in virtual care technology platforms. Visit us to learn more. Thank you so much, everyone. Thank you, Dr. Panah. We'll see you
Absolutely.
soon.
Absolutely. Pleasure meeting you. Thanks for having me.
Take care.
Bye-bye.